Hi, I'm Andrew Kirkpatrick. I'm an orthopedic surgeon specializing in hand and upper extremity at BayCare Clinic. And today we're going to be talking about tennis elbow. Tennis elbow is a very common problem. We see it almost on a daily basis in the hand surgery clinic. It is a tendonitis or inflammation of the tendons about the outside of the elbow, and it can really be limiting for people in what they're able to do. Patients who have tennis elbow tend to have pain on the outside of their elbow that can be constant, it can be achy, it can be sharp with activities. It tends to bother people at all times, but particularly if they're picking things up or trying to use their arms for any specific tasks. You don't have to play tennis to get tennis elbow. In fact, the majority of the people that we see with this problem have not played tennis. You can get it from repetitive activity, you can get it from a specific injury, maybe lifting something up, or it can just happen to people without any specific cause. I've treated many patients with tennis elbow, and the vast majority of them have basically 100% resolution of their symptoms, and we can get them back to performing activities that they desire, whether it comes to surgery or an injection, or whether we're able to treat them with a brace and some therapy. People tend to be very happy with the outcomes of being treated for tennis elbow. People that don't seek treatment for tennis elbow are not necessarily causing themselves permanent damage, but they're living with pain that they don't have to live with. There are many things we can do to make the pain from tennis elbow go away, so there is never an inappropriate time to come see us in the clinic for tennis elbow.